Yay! It
Hi, Tyler.
worked! Hi, Kevin. What's up? Finally, we got it. Technical
Right, finally my
difficulties.
work.
Shit.
Technology. Hmm.
We love it.
So happy Thursday.
Happy Thursday. Friday Eve.
Most definitely. So ready for the weekend.
I know, right? Um, okay, so it's 6 o'clock. You want to get started?
Let's do it.
Cool,
So,
cool, cool.
once again, thank you everyone who's joining us or is watching the recording. My name is Kevin Jordan Contreras. I work with Tommy in the Community Health Department at Whitman-Walker Health. My pronouns are he, him, his.
And hi, everybody. My name is Tommy Sanchez. I work with Kevin in the community health field here at Whitman-Walker, and my pronouns are he, him, his. And today we're going to be talking about monkeypox, some myths versus facts.
Awesome. Thank you, Tommy. So, as you all may know, during COVID-19 and the pandemic, we at Whitman-Walker, our community health department, we've expanded our outreach efforts to include social media or internet outreach, as we call it. We talk about various topics about HIV and STIs, sexually transmitted infections, sexual health practices, access to care and treatment. We talk about social determinants of health, public health interventions, and we're just here to provide some information and support you all, and of course, like reach out to you all virtually. Um, so, Tommy, why don't you get us started off with, just once again, real quick, going over what monkeypox or MPX, as some of us call it,
Yeah.
uh, is.
I mean, as many as you already know, monkeypox is here. It's a thing. It's usually a self-limited disease with symptoms lasting about 2 to 4 weeks. Severe cases can lead to death, but it doesn't happen often. But again, it can. So make sure, you're getting yourself checked out. Some of the symptoms that may occur when someone has monkeypox, typically presents a fever, rash, swollen lymph nodes, chills, exhaustion, muscle ache, backaches, and headaches. Just like typical like colds like symptoms. But you also may get pimples or blisters that can appear on your face, inside your mouth, and other parts of your body, such like hands, feet, your genitals, anus.
Mhm.
Just those areas. So that's just a little bit about monkeypox.
Yeah, thank you, Tommy, once again for sharing. And as always, if you have any questions or any comments, feel free to drop them in the chat and we'll address them as we go. And like Tommy shared, we're talking today about some myths versus facts when it comes to monkeypox or MPX. Um, so, as we know, monkeypox is spreading really quick across the United States as we speak. But, there are some myths revolving or surrounding monkeypox. And so today we just want to have a conversation about what some of these myths are and what the facts are, right? Just to help us understand exactly what monkeypox is. And of course, all the information that we talk about in here is always changing as we're learning more, of course. But we are using as a reference point this document or this article from Healthline regarding 11 monkeypox myths debunked by health experts, right? So these are some of the things that we're hearing, when we're talking about monkeypox in the community. So we're also going to be sharing some resources for those who are interested in knowing what to do in case that you believe that you may have been exposed or are having symptoms, or if you still have not gotten your MPX or monkeypox vaccine, so that you have that information available. Now, Tommy, can you start us off with what is one myth that you've heard about or read about, right?
Yeah.
Since we're using that interview, that article from Healthline as a point of reference. And hello, Mar from the ground, Marshawn. It's so good to see you. Thank you so much for joining us, and happy Thursday. So yeah, Tommy, what is one myth you want to
I'm
get us started with?
okay. Yeah. One would be people thinking that monkeypox is a new disease. This is the
Okay.
first time a lot of us are hearing of the word monkeypox, learning about it, hearing about it, seeing what it looks like. But
Yeah.
the truth is, monkeypox has been around for more than 6 decades. It was first learned about in about 1958. Most cases of monkeypox have been limited to several African countries where the virus is an endemic, which means that, it now lives in the population regularly, found in the community. So it's just like an everyday thing for those countries.
And it's really interesting that you mentioned endemic because, we know that this virus has been present in certain communities, like the ones that you mentioned, since essentially the late 50s. So it's just naturally there, right? Almost like
Yeah.
live with that in that area with that population. So thank you for sharing, Tommy. I'll share another one that I've heard as well. There's another myth going on around, or that we've heard as well for sure, that you can get monkeypox from the COVID-19 vaccine, right? However, we know that that's not the case. It's not possible to get COVID-19 or monkeypox or any virus from the vaccine. And of course, these are two different, completely, different viruses, right? And so I think probably, the thinking is that, oh, we're probably getting like a weakened version of a virus. So it's possible if you're immunocompromised or something for you to get sick, right? If you get a vaccine shot, but that's not necessarily the case because we are not using those type of vaccines for COVID-19 specifically, right? So you're not going to be getting monkeypox if you get the monkeypox vaccine. You're not going to be getting COVID-19 if you get the COVID-19 vaccine, and vice versa, right? So that's really important to note. Vaccines are just meant to help your immune system, fight off that disease or that virus if you are exposed to it, right? So yeah, that's one myth and one fact that I wanted to share. Tommy, do you have another
Oh my God,
myth?
there's so many. There's so
Right?
many.
We can.
Another one, people thinking that monkeypox was created in a lab. You
Okay.
know, people thinking that this was created to, pretty much destroy us in a way, but it was not created in a lab. Monkeypox originated from a colony of monkeys being studied in a research in the 1950s. Um, there have been sporadic outbreaks, of the virus globally, and the outbreaks have largely occurred in tropical rainforest areas of Central and West Africa.
Mm,
Though scientists first discovered the virus in the monkeys, the virus may not have originated from that species. So that's, again, it's not created in the lab, people. This is something
yeah,
that's been around for quite some time. We're just now hearing about it. Well, most of us are just now hearing about this.
definitely. And I'm not a medical professional or a medical provider or a scientist, but I've always been fascinated by viruses and just how complex they can be, right? So I've always thought that if someone was to create something like monkeypox or even like COVID-19, like they would definitely have to have like a lot of resources, a lot of money, a lot of just, so many things that you would need to create something like
Sounds
this,
like
right?
a villain from a superhero, like a
Exactly.
villain's
It
like.
seems almost super difficult, timely, and costly. And for sure, these individuals or this person would have to be a genius, right? To just be able to create something like this. But just like you mentioned, we know that monkeypox has been around for a while. It actually comes from a family of other viruses, similar to chickenpox. So yeah, thank you, Tommy, for sharing. I'll share another myth that I've heard, and that we for sure have heard so much,
So
uh,
many.
at this point. And that's that only gay and bisexual men can get monkeypox, right? Or that it's only for folks who are LGBT. So we know once again that the virus does not discriminate, similar to HIV and STIs. They do not discriminate against your race or ethnicity or sexual orientation. It can affect anyone, right? But we know that it's mostly monkeypox is spread through close physical contact. So of course, one of the main methods of transmission is going to be through, having sex or being sexually intimate with someone who might have uh, or has lesions, right? And has the virus with them, and you're in close proximity with them. It's skin to skin contact. So yeah, anyone can get monkeypox. It's important, like we've shared previously, to talk to your partner about monkeypox. Ask them if they have any uh, new rashes or skin lesions. And just be mindful of anything that might appear odd with your sexual partner and communicate accordingly. So that's one myth and one fact that I wanted to share. How about you, Tommy? Do you have
You know
another
the
one
one?
for us?
Yeah, that monkeypox is a sexually transmitted infection.
Okay.
This is not the case. Although monkeypox can be spread through sex, it's not the only way someone can be infected with the virus. You know, clothing, not washing your bed sheets, just so many different ways besides intimate contact that this virus can actually spread. So it's not an STI. We don't treat it as an STI, especially here at Whitman-Walker. We don't identify that as a sexually transmitted infection because you can get it more than just being sexual with somebody. So that's just, another little myth and fact for you guys.
Yeah, definitely. Thank you, Tommy, for sharing that. So, of course, we know that, being sexually active with someone, it's not necessarily the only way that it can spread, right? So it can also be spread through skin to skin contact. That's not, like necessarily through sexual intimacy, right? So yeah, these are some of the myths, most common ones that we've heard. And so we just wanted to take a couple of minutes to discuss that and talk about that. And so right now, we just want to talk a little bit about what should you do if you believe you've been exposed to monkeypox, or if you believe that you're experiencing symptoms. There is a couple of resources, especially for folks who live outside of the DMV. There is this wonderful tool that was created, I believe, by someone that you spoke with last week, Roth, who used to work with us at Whitman-Walker, actually, and is now in New York doing some fantastic work. And the website's called mpoxvaxmap.org. And you can also search through it by Googling mpoxvaxmap.org. And actually, Tommy, if you wouldn't mind just real quick writing that and putting it on the chat. And so depending on where you live, you can look up to see if there's any available vaccines. There we go with the link. Thank you, Tommy. So that you can see, where you can get your monkeypox vaccine. Right now, Washington, D.C., as we know, has expanded the eligibility criteria for folks who are eligible to get the monkeypox vaccine. We started off with, of course, DC residents, but if you live in Maryland or Virginia and you work in DC, or if you receive healthcare services in DC, you are eligible to get the vaccine for monkeypox, right? And some of you may have heard or experienced that right now the vaccines are being done differently in the arm. And so, it's very common to get just a little bit of swelling, right, and some redness. But that's totally worth it, right, Tommy? Because you're essentially being protected for a virus that can cause a lot of complications, a lot of problems. It's very
Even
painful.
death.
In some
cases, yeah.
It can cause a lot of complications. So, we just want you all to be safe and know what you can do. If you have not been vaccinated. Now, real quick, let's just talk about what you can do if you believe you're experiencing symptoms. So just like Tommy shared with us earlier, it starts off with like cold and flu-like symptoms, right? So we know from the pandemic and from COVID-19 that you want to isolate yourself. You want to wear a mask if you must go outside. COVID still around. The flu season is just getting started. Also a reminder to get your flu shots as well. And so what you want to do is, of course, isolate, monitor yourself if you see any skin abnormalities, like any rashes or any lesions. If you have a primary care physician, you can contact your primary care physician, get in touch with them, try to set up an appointment with them or a telehealth appointment if you can't make it to your doctor's office. And if you do not have a primary care physician, you can call us. And if you're within the DMV, of course, you can call Whitman-Walker. You can call our main phone number 202-745-7000 or email appointments@whitman-walker.org. That you need to be seeing for an evaluation if you have a skin lesion or a skin rash. And if you're a medical patient with us, you can, of course, message your provider through the portal, or you can also call or send an email as well. We also have a resource, COVID-19/monkeypox or MPX hotline, where we can answer your questions. And I believe, Tommy, correct me if I'm wrong, that would be 202-207-2480. But let me just double check here real quick in my notes to make sure that I'm providing the correct phone number for that line. But yeah, Tommy, any other thoughts regarding resources or just how to stay safe in general during these times?
Even through our other social media posts that we have that have been going out, weekly, that's keeping you up to date, well informed on information in regards to monkeypox. So that's another great source of a way to get information, get answers that you may have questions to. It's all on Whitman-Walker's page. So that's also another source for anyone looking for questions or having questions that need to be answered. That's a good one.
Definitely. And I have the phone number right here. So I'm glad that I was able to confirm. So I'm not giving y'all the wrong number and then someone's calling, like, I don't know, a pizza place in DC or something like that. So our phone number is going to be 202-207-2480. You can call us at that line if you have any questions regarding monkeypox, if you believe you've been exposed, or if you need help accessing services regarding monkeypox treatment or vaccination, or also if you have any questions regarding COVID-19, right? Because we know that at first the symptoms can be very similar, cold or flu-like symptoms, and the cold season is just around the corner. Summer's about to end. If you have any questions, feel free to call us. We're usually available Monday through Friday from 9 to 5:30 p.m. And if we cannot answer your questions, just feel free to leave us a voicemail and we'll get back to you within 24 to 48 hours. So that's just something real quick that we wanted to share. Also check out our social media. You can also check out the CDC's website for monkeypox as well. You can also check out DC Health's website as well regarding information for the walk-in vaccines, right? Because we know that as of August 5th, there are walk-up vaccinations that's available from 12 noon until 8 p.m. And it's usually while supplies last. And there's 3 locations, right? There's one on Martin Luther King Jr. Avenue, one on Georgia Avenue, Ward 4, and one on 1900 I Street Northwest in Ward 2. I believe we have like social media posts on our Whitman-Walker Instagram page regarding this as well. So you can always check out our Instagram and our social media for that information. And so once again, Tommy, if you don't mind just walking us real quick about the the current eligibility criteria for being vaccinated in DC. Who's eligible, basically?
Yeah, residents, you have to be 18 years or older. Now it's open to everyone. It's not just part of the LGBT community. All people of any sexual orientation or gender who have sex with multiple partners, sex workers, staff of any sexual orientation or gender as well, at establishments, where sexual activity occurs, places like bathhouse, saunas, sex clubs. Those are a few, eligibilities for individuals. Of course, they are going to ask you for proof of residency, such as like identification card with the DC address, a utility bill, or any other mail that's in your name with the DC address, even a current DC lease or mortgage with your name on it.
Awesome. Yeah, thank you so much, Tommy, for sharing that. So, folks, just if you haven't already gotten vaccinated, we encourage you to. If you have any questions, reach out to your provider. You can also reach out to us, and stay safe, most importantly. So thank you all for taking some time with us to be present in this virtual space to talk a little bit more about monkeypox. talk about, we talked about some some facts versus myths, right? So Tommy, any closing thoughts?
No, just, everyone stay safe, take every precaution to protect yourself. Everyone has different ways of protecting themselves based on their lifestyle. Um, yeah, and if you have any questions, you can reach out to either one of us on our Instagram, Whitman-Walker. You can give us a call, shoot me a message. Yeah, and I'll be more than happy to provide any information that I can get to anybody.
Awesome. Well, thank you so much. Thank you, Tommy, once again. And yeah, we will see everyone around. Stay safe and happy
Thank you,
Friday.
everybody. Yes.